So, I'm an internal medicine doctor who treats patients in the hospital, in the emergency room, in the intensive care unit. I see their heart attacks and their strokes, and I see them for their pneumonias. Why am I teaching mindfulness? And you might be considering, isn't mindfulness just some spiritual stuff or some philosophical stuff? Isn't it just kind of breathing or just meditation? I think of mindfulness as psychological skills that work like you take a pill. And one thing that a lot of people say about mindfulness is that when they do it, they don't feel any different. But if you ask yourself, a lot of the medicines that we take, especially for chronic illnesses like blood pressure or diabetes, they don't make us feel any different either, but they help treat a disease. And in the case of blood pressure or diabetes, what they also help us do is prevent heart attacks and strokes and going to the hospital. These skills, they help rewire our brain. It's kind of like exercising. You go to the gym and you exercise and you're trying to build up muscle. You don't build muscle immediately. You don't feel that or even see that. Mindfulness is very much the same way. Well, it turns out that our bodies are very connected to our minds, and our minds are connected to our bodies as well. In fact, they've tested mindfulness and other psychological skills and therapies like they test medicines. They use randomized controlled trials, and this is just technical talk about how they've tested these medicines. Mindfulness and its clinical results are reported in the same journals that I look at for medications for heart attacks and strokes. And one particularly impressive study was one where they've tested mindfulness and anxiety medicines, and they found that they work similarly. And from a doctor's perspective, I would much rather teach my patient mindfulness, which has no real side effects, than prescribe anti anxiety medications, which do have side effects and they can be very addictive. And it turns out that the same psychological skills that work for anxiety work for depression. And these skills are also used to help patients treat obesity. Oftentimes, we tell patients to change diet and exercise, and some patients can make those changes, but temporarily. With psychotherapy, it helps those changes stick. So that's why I teach mindfulness, and that's why I work with psychotherapy. These skills that you can learn, they also help you prevent getting heart attacks and strokes, and also they help you treat your diabetes and high blood pressure and high cholesterol. In fact, these skills may help you treat your chronic illnesses like diabetes and high cholesterol and obesity, and you might go into remission as well without any medications. And as a doctor, that is truly, truly important for me. So give mindfulness a try, give psychotherapy a try. It isn't for crazy people. I use it on myself. I tell my friends about it. It's not something weird. It's just another tool that can go into your healthcare toolbox. Thanks for joining me for this session of mindfulness training. And check out the other sessions as well, and also the companion resources that I've put together to help you explore and enjoy the benefits of mindfulness.